regardless if we work alone or if we work in an integrated facility, we do most of our work in psychiatry behind closed doors, right? We're meeting with patients much of the time one-on-one, and we don't get to see our colleagues in action. We might see them briefly in passing and in the hallway or at a meeting, but really we don't get a chance very often to sit down and say, hey, how do you do this at your job? How do you treat these conditions where you work? And to me, that's one of the most exciting things about Psych Congress, is not only do we get to learn from the presenters, but as much as we get to learn from the presenters, we also get to talk to each other. And I learn as much probably talking to people in the exhibit hall or talking to people in the hallways as I do in the sessions. And that to me serves a valuable need to interact with the people that are doing the same kind of work that I do and learn from them. I also want to make a special mention to my fellow nurses. I am a psychiatric nurse practitioner, and I am bringing a nursing perspective to the planning of this conference, and part of that is having nurse presenters at this conference. Because the reality is that while we all come from different backgrounds in mental health, and mental health is peculiar in that there are so many different people, different types of training represented at the table, if you will. We have psychologists, we have social workers, we have nurses, we have doctors. There are so many different types of providers. But the reality is we're all doing very similar work. We're all trying to take care of patients with mental health conditions, and we're trying to do the best job we can. And our titles sometimes, frankly, I think kind of get in our way. And we assume what somebody knows or what somebody thinks because of the letters after their name. And so one of the things that we did last year, which was kind of exciting, is we actually took those letters, those credentials, off of name tags. We just had people's names on their name tags. And so that people would have conversations without assuming what the other person knew or what the other person's experience was. And that was really exciting because it allowed for more interaction between different types of clinicians without the barrier of a title getting in the way. And so I really want to encourage my fellow nurses to come to this conference, because increasingly we're being called on to do more and more complex work, and we need to have the same knowledge that all of our colleagues have in order to have a seat at that table and to be able to represent ourselves well as a profession there. And so I really am excited when I meet nurses there, and I look forward to meeting other nurses at Psych Congress in San Diego this year.